The suffering and death of George Floyd is tragic and abhorrent. It's an American tragedy. It should be condemned by leaders at every level. In Arizona, we will listen to those that want to have a civil discourse to ensure that it never happens again in the United States of America, and that we make the proper reforms and improvement at both the state, national, and federal level. There are 7.3 million people that live in the state of Arizona, and thousands upon thousands have come out day after day to have their voices heard, to exercise their First Amendment rights, and to ask for justice. These peaceful protesters have been out in cities and towns all over our state and all over our country. In Arizona, we're listening, and we're looking at this as an American moment where change can happen for the better in our nation. A much smaller group that wanted to riot and loot have come out as well. And I want to say thank you to the women and men on the front lines who protect and serve us every day in the state of Arizona. That's our law enforcement personnel, our medical professionals, our first responders, and our local and community leaders. This has been a time where people want to be heard. They've seen an injustice. They want to see change. And in Arizona, we're able to do it in a safe and peaceful way. I want to say thank you to the people of Arizona for their civic mindedness, their responsibility, and their involvement in this pursuit of justice for George Floyd. I want to talk a little bit about our local communities. I've been talking and visiting and making a lot of phone calls to leaders across the state. I think I talked to 20-plus mayors on Sunday, law enforcement leaders from across our state, and I've asked them to be vigilant so that we can allow the peaceful protest to happen and we can protect people, property, and our citizens, and that we can stop whatever looting and rioting that is happening. I'm also listening to leaders in our community, both the African-American community and our minority community. We had a discussion on Sunday evening. We came up with a list of deliverables. It wasn't my first meeting with these leaders. It won't be my last, and I know there's more we can do. Going forward in Arizona, we can continue to protect people's constitutional First Amendment rights by protecting peaceful dialogue. After the tragedy in Minneapolis, a national movement and dialogue, along with reflection, has happened. In Arizona, we will listen and we will act. We can also combat violence and destruction. Arizona will not confuse peaceful protesters and demonstrators with looters and rioters. We will protect peace and order to honor George Floyd's memory. I want to say that I feel blessed in Arizona to have the finest in law enforcement leadership in the country. And it begins with the Colonel of the Department of Public Safety, Heston Silbert. I also want to say a special word of gratitude for Chief Jerry Williams at the Phoenix Police Department and the brave men and women in the Phoenix Police Department, along with the Department of Public Safety. I'm also fortunate to enjoy relationships with Chief Chris Magnus in Tucson and Sheriff Mark Napier and Paul Penzone. And all of these folks have been backed up by the brave women and men of the National Guard and Major General Mick McGuire. I'm grateful for all you've done, the peace that you've brought to the state of Arizona to allow our citizens to exercise their constitutional rights. And I'm going to turn it over to Colonel Silbert to give us an update on the law enforcement and public safety front. Colonel?
Thank you, sir.
Oh, one moment, Colonel. In consultation with law enforcement leaders, there is a statewide curfew. Through Sunday, June 7th, from 8 p.m. to 5 a.m., this has been through discussions with local leaders and law enforcement. This is a tool for law enforcement to protect law and order and our right for peaceful protests. And part of the reason that this was statewide, we did have incidents in Yuma County, Yavapai, Prescott Valley, Mojave County, Tucson, Phoenix, Scottsdale, Chandler, and the West Valley. So this was to ensure peace and safety, and so far it's worked. Take it away, Colonel.
Thank you, sir. I want to begin echoing some of the governor's sentiments. I've been in law enforcement for 31 years, and during that time witnessed tragic and use of force situations to varying degrees. And I can tell you in my 31 years, I don't know if I've ever seen anything as horrific and tragic as what happened to George Floyd in Minnesota. And that has been foremost in my mind in the manner in which we handle the situations that we're dealing with here in Arizona. We've had the opportunity to talk to people in the community. I'm proud of our community, quite frankly. Yes, there are some people who I would say hijacked the cause and didn't do honor to the death of George Floyd by looting and rioting. But I will tell you, by far and away, everything I've seen from the citizens of Arizona, the manner in which they've demonstrated, the manner in which they've protested, has been a commentary to their character and really to our state. You see people out there, it's 110 degrees outside, and they're out there all day in the heat, and they're genuinely protesting. People don't go stand in the heat by the thousands who don't care. They care. They care about this cause. They care about what's going on. They care about the improvement, and we care. We always know we can do a better job in law enforcement. And we understand that we're only as strong as the violations that one person commits. And unfortunately, we all have to answer for that. But if improvement comes from that, and it certainly should from this situation, I hope for better days ahead. The men and women of our agency, the agencies throughout the state, have worked cohesively together to do our very best to match communication with tactics so we can quell any situations that arise. And at the end of the day, our goal is we don't want to see more people get hurt, certainly while they're just trying to express their First Amendment rights. And we continue those efforts, and we will continue those efforts going forward. I hope to think that this will not end because George Floyd's funeral will take place next week. I hope we learn and grow going forward and become a better nation and become a better community, and that his death is representative of us becoming a better country.
Thank you very much, Colonel. And now I want to ask Major General McGuire to give us an update both on, let's start with the Guard.
Yes, sir. First, I want to say thank you to all of the citizen soldiers and airmen that have answered the call over the last 12 weeks. I can say in my duty that I serve in concurrently as the Director of Emergency Management and the Commanding General of the Guard under our Commander-in-Chief, Governor Ducey. I never envisioned us having two simultaneous statewide emergencies occurring at once. That said, as it pertains to the Guard missions and the things that we've been asked to do beginning on this past Saturday, as each of you know, we're sworn to protect and defend the Constitution of the great state of Arizona and the United States of America. And we take wearing the cloth of the nation very seriously. And all of the rights conferred in that Constitution to every citizen, regardless of race, gender, or ethnicity, is something we protect. Many of us in the past have had to give our lives to protect that. And in this particular case, as it pertains to the call-up of the Guard over the last weekend, we do have a standing National Guard emergency response force. In my 7+ years in this role, I have not seen that ever be called prior to Saturday. In that case, Sheriff Penzone, as the elected chief law enforcement officer in Maricopa County, spoke with me, spoke to the governor's office, talked to Colonel Silbert, spoke with Chief Jerry Williams, and that night we were able to put out 122 of our National Guardsmen in support of 3 specific agencies: Maricopa County Sheriffs, Arizona Department of Public Safety, and the City of Phoenix. Unfortunately, there were events in Scottsdale that night that precipitated additional asset and resource requests. And since that time, we have added 9 jurisdictions. I don't usually bring notes, but I want to read them. Individual jurisdictions that have asked for direct support since Sunday: City of Chandler, City of Flagstaff, City of Glendale, City of Goodyear, City of Kingman, City of Phoenix, City of Prescott, City of Scottsdale, and City of Tempe, as well as 4 county sheriff's office: Maricopa, Yavapai, Coconino, and Mojave County, and the Arizona Department of Public Safety. All in, we have 1,421 guardsmen on duty today, up from 122 on Saturday. I couldn't be prouder of the way they have created an environment of peaceable opportunity for our citizens to express their concerns while providing an environment where law and order can be maintained while we protect the supreme law of the land, the Constitution of the United States of America. So I'm very confident that while the state and the nation are in pain, that our great citizens in this state that have an unbelievable reservoir of patriotic capital will rise to the occasion and work together to create a peaceable environment. As it pertains to the COVID-19, we continue to do that, and while those 1,400 are out there, there are 860 of their fellow service members continuing to do all the things that we have done for the past 12 weeks. I can tell you that never in the history of the National Guard since 9/11 have we deployed as many people forward into a foreign nation as we have deployed in the last 12 weeks here in the great state of Arizona. All in, over 3,000 of the 7,600 available guardsmen are on duty today, stepping away from their jobs in the communities as your teachers, as your coworkers, as your parishioners in your churches. And they're out there now doing their very best to show how great Arizona can be. Thank you.
Thank you very much, General McGuire, and I want to say to Colonel Silbert as well, just again, thank you for your commitment, for the brave men and women who wear the uniform, and for the partnership that you have with law enforcement leaders across our state. Yes, incredibly grateful. I do want to transition into talking about public health and COVID-19 and give you the most recent update. We'll continue on the path to be calm and steady with an urgent posture to protecting our public health, and our emphasis will be on data-informed decisions. This is the same gating criteria that I've been taking you through for weeks in terms of where the state of Arizona is. We did have another video teleconference. Was it this morning? It was yesterday morning with Dr. Robert Redfield, Dr. Deborah Burks, the leaders of our federal partners. The days have been, it's been an incredible pace here, but we're staying focused on both, and we've got some of the best people in the nation in Arizona leading both the public health effort and the public safety effort. So I want to take you through Arizona's symptoms, cases, and hospitals. What we're looking for in our symptoms is that downward trajectory of influenza-like illnesses reported within a 14-day period and a downward trajectory of COVID-like cases within the 14-day period. You can see the blue line represents COVID-like illness and the gold is influenza-like. This is week after week, good result. Proper direction and a downward trajectory is what we want. This is positive. On cases, we want to see downward trajectory of documented cases within a 14-day period or downward trajectory of positive cases as a percent of total tests within a 14-day period. In terms of cases, again, what you see here is a lot of data and information. We don't have a trend established at this time. We've seen some growth in cases as of late, and we'll look at where we are in terms of percentage positive. The blue part of the graph represents the testing that we've done, and you can see the dramatic increase in testing. You can see the flattening of the curve. The gold line represents the positive cases of COVID-19 in terms of tests. These are all PCR tests or diagnostic tests. I'm going to let Dr. Chris talk about what we see here in terms of where we are in her projection of where Arizona would be at this time. But I also want to say, as you see an increase in testing, we've been consistent in saying you will see an increase in cases. The virus is widespread. It's in every county and every state in our nation. What we wanted to do is be prepared for the increase in cases so that we have capacity inside our hospital system. So let's take a look at where we are on that. And the measure here from the CDC is that we can treat all patients without crisis care. These are the graphs you've seen in past weeks. Gray represents available beds. Blue is inpatient beds in use. And gold represents inpatient beds used for COVID-19 patients. You can see fairly flat across COVID-19 patients with a tight tolerance of a few percentage points. ICU beds, intensive care, if someone were to get especially sick and be in danger, the same graph applies in terms of the color palette. Gray is available beds, blue is occupied beds, and gold is COVID-19 beds. You can see along the gold line, it's been pretty flat in terms of people that have COVID-19, in terms of our ICU beds. What we want to see is that trending down. That flat is dramatically better than spiking, but we'd like to see that trending down. Ventilators, you can see we've got a lot of ventilators, and we're prepared for come what may to Arizona. In terms of testing, we want to increase testing. There's been a real focus on testing and the surge. I think we're heading to our 6th weekend of a testing blitz. Again, the more we test, the more cases that we're going to have. I think the all labs number actually needs to be updated. I think we're up north of 345,000 tests in terms of cumulative, with over 200,000 diagnostic and 100,000 plus from an antibody perspective. And with that, I'm going to let Kara Christ dive in to the data and what it means for Arizona. Dr. Christ?
Thank you, Governor. So there's a lot of different things that we wanted to talk to you about today. We wanted to provide an update on where we are with our long-term care facilities, because our goals in Arizona have been to protect those vulnerable populations, which include those living in a congregate setting, and as well as increase the capacity of our healthcare system. So as of Today, our licensing team has gone out and completed the infection control surveys at 126 of our Medicare certified skilled nursing facility. We do have additional surveys scheduled for this week with 100% of those skilled nursing facilities to have that survey completed by June 9th. This is a requirement by CMS to have them all completed by July 31st. So our teams are out there, and then they will go back and continue to reassess. For the testing, specimen collection has been completed at 71 facilities. 15 are doing their own testing, not on behalf of the state. We've tested a total of over 8,000 staff and individuals, and we continue to work, and we'll have all of the facilities tested by June 11th. As we work with our correctional facilities, we continue to provide serology testing. We are allowing those individuals that want to go get it tested for themselves at one of the U of A testing centers. They can do that whenever they want by signing up through the website. However, we understand that some of our facilities are in rural areas and may not be close to a testing site. So we are contracting with Sonora Quest to make sure that they go out to the sites to actually draw the blood for the serologies there. We've been helping with the Yuma facility and are providing the supplies to ensure that all of the staff at that facility have been tested and have access to diagnostic testing. And my epidemiologists have been working very closely with the Department of Corrections, Rehabilitation, and Reentry on infection control surveys at each of the facilities. So we've completed walking through an infection control assessment and response survey, and we will be going on site to every single facility to walk those facilities. Talking about the statewide trends, so Governor Ducey showed that we had a significant increase in the number of cases reported to the department. This was expected. So we have done a number of things, including increasing testing. So as you test more, you are going to find more. We've also slowly phased in reopening. And as we know that COVID-19 is still in the community, as people come back together, we know that there is going to be transmission of COVID-19. As we're seeing increases of COVID-19 patients in our hospital metrics that are on our dashboard, we are also seeing increases in non-COVID-19 related admissions, and we're seeing pretty significant admissions. And again, this was something that we expected as we opened back up and as we allowed for elective surgeries. We know that people are now feeling more comfortable about seeking care and seeking appropriate care. So we did expect those numbers to go up. We continue to monitor this data and make recommendations based on the data that we're seeing. There's a couple of other things that have come up in the last week or two that we're monitoring from a statewide perspective. So in our southern region, our counterparts across the southern border have also noticed an increase in cases. And what that is doing is it's driving some of those cases back up north to California and Arizona hospitals. So we are seeing an increase in cases in Mexico, as well as several outbreaks associated with the southern border. We're also seeing large numbers within our tribal communities and our northern and our eastern regions as well. So we continue to work with those populations, but we are seeing increased cases. One of the things that we have been working on, and this gives us real-time information about what is going on the ground in our hospitals. So the Arizona Surge Line, which is our 24/7 statewide call line for hospitals and their providers, has currently assisted hospitals statewide with over 583 patients, and we have facilitated the transport of over 500 patients statewide. We are really thankful to our on-the-ground hospital partners who have collaborated to build this statewide system, and this has been very successful in protecting our hospital capacity. And everybody has a part to play. So as we slowly open back up and people start going back out into the community, everybody has a part in this. So we ask everybody to continue practicing that good hygiene. Make sure that you are washing your hands or using an alcohol-based hand sanitizer, especially after touching frequently used surfaces, items, or your face, your eyes, your mouth, your nose. Avoid touching your face, and that's where you're going to be able to get it onto your fingers and transmit it to others. We want to make sure that you're covering your cough or your sneeze, you're disinfecting frequently used items, and you consider using face coverings when you're out in public and cannot appropriately physical distance. And we ask that anybody who feels sick that please stay home. Do not go to work, do not go to school, and make sure that you follow the guidance of your healthcare provider.
Thank you, Dr. Christ, and thank you for the hard work of the women and men of the Department of Health Services. Let's look forward in terms of Arizona returning stronger and planning ahead here. We're going to continue to do this the Arizona way, focused on our state and its specific situation. The return will be gradual and phased in. We're going to balance public health with a focus on returning stronger. We're going to increase testing to return in May while maintaining strong physical distancing. And that, I know there's a lot going on in our state and our country, but I think these are important things to continue to touch on, to talk about, and to remind each other of. And we'll phase in the return based on the recommendations of the CDC and health experts throughout May and June and over the course of the summer. 2 weeks ago, I was able to meet with school leaders. I want to say thank you for their good work. I want to say a special thank you to Superintendent of Public Instruction, Kathy Hoffman, for her leadership, her partnership, and commitment to Arizona children. I also want to thank the supervisors, the principals, the teachers, the staff, the faculty, and the parents who all helped inform this plan and make it possible. We're getting input from public health experts and education leaders. These recommendations, along with providing flexibility to school leaders so we can not only conduct summer school at this time, but school in the fall. We're going to be putting forward health and safety precautions along with distance learning plans. I want to give you, in addition to everything that is going on right now, it is high tide for fire season in the state of Arizona. And we have 4 fires actively burning that I want to touch on right now. The Sawtooth Fire, the Ocotillo Fire, the Range Fire, and the Sunset Fire. Of course, I want to say thank you to, I mean, you're seeing the best of state and local government in terms of protecting our state. And in this situation, it's much of what we talked about. We want to focus on people, pets, and property. And this is what the brave men and women of the Department of Forestry and Fire are doing. I know that emergency management is also backing them up, and I want to say thank you for doing that as well, General McGuire. And lastly, before we take questions, I just want to say thank you to the people of Arizona. A lot has come our state's way and our nation's way. Our citizens have demonstrated incredible patriotism, commitment to the causes of our country and to a better place to live. And I couldn't be more thankful as a governor for the great, wonderful, hardworking, committed citizens in Arizona. And with that, we'll open it up to questions.
Howie? I know my colleagues have a lot of stuff about the police, but I want to start just a little bit with the issue of COVID. I noticed that your charts on the positive tests ended on May 31st, which is convenient since on June 1st the positive test went to 6.5, June 2nd 11.5, June 3rd 14.7. We're really at 1,000 deaths. We have 1,079 hospitalizations. Our numbers per 100,000 are higher than California. Did you screw up in terms of letting people go back to work, go out and do stuff? It seems like ever since then, the numbers have been rising.
The fact that we were going to focus on having more tests meant that we were going to have more cases. You can go back and play the tape of these press conferences weeks going back. We anticipated that. Dr. Christ said we were going to have the height of hospitalizations and cases in May and in June. That was what our modeling, what the Department of Health Services have planned for. What we wanted to do was to be prepared for this. And that's why I took you through the hospital capacity, the intensive care capacity, and the ventilators. We want to care and comfort for people that are sick. Arizona is prepared. Do you want to touch any more on where we are in cases?
Sure. So as we continue to monitor, we are seeing an increase in cases, and the May 31st is the week of, Howie, so it would include all the numbers that you're talking about for the percent positivity, and so
Not for June
we'll
1st,
continue.
2nd, and 3rd. When you're at 14.7, we have never been at 14.7%.
But that's on a daily basis, and so when you're looking at it on a daily basis, we do look over it because it's going to depend on what the laboratories report on that day. So and then we look back at the collection date. So we continue to monitor that data. We are seeing it go up. It's not unexpected, especially as we are targeting some of those higher, more vulnerable areas and including higher numbers of long-term care, higher numbers of correctional officers in prison. So we are going to see changing numbers, and we expect that.
Okay, but then the one thing that has nothing to do with the testing rate, there were 996 deaths, Arizonans who died as of yesterday. I'm guessing we've had 4 more since then. We should be over 1,000. Does that not alarm you, Governor? Again, you made the decisions about reopening.
Howie, we mourn every death in the state of Arizona. Everything that we have done since the original emergency order on March 11th and the first executive order to protect people in long-term care has been to reduce the spread of this virus and to save and protect as many lives as possible. And I'm confident that we've made the best and most responsible decisions possible, guided by public health the entire way. This virus is not going away. We will continue to work to make sure that we can care and comfort and help anyone that is severely ill recover. We have the capacity to do that, and we'll continue to do that.
If the virus is not, just real quickly, if the virus is not going away, why are you reopening things? Why are you going to allow people in swimming pools? Why are you going to allow people in gymnasiums?
We are focused on the population that is most vulnerable. These are folks of a certain age category with underlying chronic health conditions that are at high risk, have tuberculosis, infectious respiratory disease, diabetes, or obesity. For the rest of our population, we've been pretty vocal about who is in harm's way and who can participate in the opening of our economy. We'll continue to do that. We'll continue to do that.
We're going to go over this side of the room with Billy at iHeart. Thank you, Governor. Billy Harfash, iHeartRadio. Governor, I live in Old Town Scottsdale, and it was a very scary situation last weekend. I talked to a lot of residents, business owners down in Old Town, and they want some answers from you. Were the police ordered to stand down? Were the police not ready? And if this happens again, are the police and the National Guard going to be given the go to go ahead and do their job?
Well, Billy, the first thing I want to say is we've been learning along the way here. I think that the Department of Public Safety and every law enforcement agency has gotten better day after day. We learned a lot from Friday to Saturday night in Phoenix. And again, I thank Chief Jerry Williams and Colonel Silbert. And we've done our best on Sunday to share all of those learnings with all of the police chief, law enforcement leaders, and mayors from across the state. So I think the simple answer that I would give you is that's not going to happen again. That's the intention. That's why the statewide curfew was issued. That's why the National Guard was brought in, so that we could avoid the looting and rioting that you saw in Scottsdale.
You got a question? Melissa, do you want to go?
Yeah. So my question is about the hospital capacity situation. At what point, at what percentage capacity do the hospitals have to be for you guys to declare that there is a crisis care situation at the hospitals? In addition, we've heard that that the RFP for St. Luke's Hospital has not been filled, so there's no operator.
Do you want to touch on that?
Sure. So we're continuously monitoring the hospital capacity status, and there's, while beds are a portion of a hospital being able to operate either inside or outside crisis care standards, there's a bunch of other things. If they are using protocols to prioritize who gets a bed, who gets medicine, who gets a ventilator, and we are not in a crisis standards of care protocol right now. So we continue to monitor. I don't know that it will be a specific percentage that would trigger that, but it will be looking at the totality of the data. In regards to St. Luke's, we are going to continue to have St. Luke's as a warm site. So we have not been pushing the RFP because right now it is a warm site, and we do have plans to be able to stand it up immediately if we look like we need that additional capacity.
Okay, so no operator yet. How soon after you have an RFP and someone chosen could you actually start caring for patients at that place?
So we could start caring for patients relatively quickly, and so we will give ourselves some time if it looks like the capacity is increasing. We do have contracts on standby that we could bring in order to operate St. Luke's.
Thank you.
Yeah, Governor, you were saying that this moment in time right now is a time that for change for the better. Democrats at the legislature are calling on you to add to the special session police reform. Specifically, they want legislation passed that require all police officers to wear body cameras. They want more sensitivity, de-escalation training, among some other things out there. Likewise, the Attorney General Mark Brnovich has echoed some of those same ideas. Are you going to add this to your special session call that you're expected to make later this month or early next month?
Thanks, Dennis. I want you to know that we're in receipt of the request from the Democratic caucus. I'm going to work with legislative leaders on both sides of the aisle. The legislature has sine-died in this setting. I'll remind you that part of my original agenda that was released January 13th was that we would bring body cameras to all sworn officers of the Department of Public Safety. So I also sat down with leaders from the African American community and minority community on Sunday. We put together a list of deliverables. These are things that I want to see have happen, and they're things that we're going to focus on.
Sure, but the two officers that were involved with the Deion Johnson situation, the man who was shot and killed, they didn't have body cameras on there. Care to respond?
Well, the legislative session was interrupted by a worldwide pandemic. This is a commitment that I had on January 13th, well before any of the issues that we're mourning today happened, and it remains on my legislative priority list.
So what do you want to see moving forward? Are you going to deal with police reform in the special session then? And what do you, as the governor, want to see done beyond just body cameras?
Well, body cameras are something, like I said, that we already said that we want to see. I am going to work with Colonel Silbert. I've been working with Frank Milstead. Before that, I've had discussions with Chief Jerry Williams. I believe there are things that we can do in Arizona, from training to diversity of our law enforcement forces to how we interact with the citizen. I think there's a lot that can be done. There's other things that we talked about in the meeting on Sunday evening around making AZ Post more diverse, adding more members to it. They also asked for a hearing or a briefing on what happened with the DPS officer-involved shooting. So we're going to tick down all of the deliverables, and then there will be more to do.
We're going to go to the board next. Stephanie Inez with the Arizona Republic. Stephanie, go ahead.
Thanks, Governor and Dr. Christ. I have two related questions. One is, given the numbers that we're seeing, are you willing to say that we're seeing an increase in community spread in Arizona of COVID-19? And the other related question is, what is your current guidance on gatherings of 10 or more people?
Thanks, Stephanie. So we are seeing an increase in cases. I think we would have to go back. We know that we've got a little bit of a reporting lag, so we would have to go back and see where the majority of those cases, if they're coming from the specific targeted testing that we're looking at, or if it looks like it is community spread. And I don't have the answer to that question right now, but we are continuing to monitor. I think in relation to the other question, our current guidance is to if you've got close small gatherings, to keep it at 10 or less. However, people do have a constitutional right to be able to have a peaceful dialogue. And so we would encourage that those that are at risk of or are vulnerable to COVID-19, that they do not attend large gatherings if possible. We want everybody to take the same precautions, so make sure that you're washing your hands frequently or you bring hand sanitizer with you. We know that it's difficult, but try to stay 6 feet apart from other people. Maybe travel with a group that you are normally with so that you don't expose others, and wear a face covering if possible while you're there.
I ask this with all due respect, as it may be a difficult question to have to ask, but or to answer to. Faith leaders who met with you this week, they met with you in person. They say that they worry that you suffer from white privilege. What is your response? And protesters are trying to tell leaders like you about systemic racism. Do you see this systemic racism here?
So I met with leaders. Like I said, it wasn't my first meeting. It won't be my last. I think we spent about 90 minutes together. I spent nearly the entire time listening and learning, and I'm going to continue to do that. One of the questions that was asked of me at the meeting is if I thought racism was a sin, and I said, of course it is a sin. And our discussion did revolve around some of those subjects.
But they worry that you're not understanding systemic racism. What are you hearing from the protesters? What are you taking away from what they're asking leaders like you to do?
What I'm hearing is that people are sickened by what happened, and I share that emotion and feeling as well. They're asking for change, and they're asking for reform, and they've had enough of this.
And what's your response to them saying that you suffer from white privilege? Do you agree with that statement?
I'm learning.
Thank you. Getting back to the COVID data, there was a graphic up there behind you, Governor, a few minutes ago showing cases going like that, like a hockey stick. You said there was no trend. Experts say there is a trend, and the trend is cases have taken off ever since the stay-at-home order ended. Maricopa County, Dr. Chris said today, for the first time in a long time, the infection is spreading. There is community spread. And I will use the word cherry picking because we've seen this over and over. On your positive test graphic, it says 7.8% this week, positive tests. The number is over 10% this week. The experts agree, not me, I'm not an expert. The experts agree cases are going, everything is going in the wrong direction since the stay-at-home order ended. You have said in the past, I'm going to monitor this and make adjustments as needed. So given that information, given those facts, what changes will you make?
Sure. So the expectation was that cases would rise. This is what we expected. The charts that I'm showing you today, when you have seen these are the same charts with the same equations to come to the numbers that we show you on a weekly basis. That's what we've done. That's what we'll continue to do.
I'm sorry, sir, that doesn't answer the question, because what the experts are saying is...
Bram, I happen to work with experts. Okay, hang on, Bram. I work with an infectious disease epidemiologist, a medical doctor who happens to be a public health expert. Do you want to take it from here, doctor?
So we will continue to monitor. We expected the cases to go up, and we will look. We have a number of tools in the toolbox. If we start to look at our hospital capacity, if we have any concerns about the inability to treat, we are seeing an increase in cases, and so we will continue to monitor at this time. But we have to weigh the impacts of the virus versus the impacts of what a stay-at-home order can have on long-term health as well.
So right now, the data shows that the state is out of compliance with White House guidelines, the testing criteria. We are out of compliance as of the last 2-3 weeks with the testing
what
criteria.
you heard today was no escalation from phase one. So the adjustment
But
is...
the question is, has phase one gone too far?
No, phase one has not gone too far. We'll continue to monitor what's happening. And what we're going to do is make certain that we have proper capacity to care and comfort for people that need it. And today we do.
Question,
We've got a couple of them. We gotta go. You know, come back. We're gonna go to the board. Vaughn Hilliard from NBC News. Vaughn, go ahead.
Hi there, Dr. Chris. Governor, thank you guys. I appreciate it. Kind of jumping off asking there, we saw in the last 2 weeks, seen an uptick in influenza-like cases. We did not see a downward trajectory of positive tests as a percentage of total tests within a 14-day period. We have seen a climb in hospitalizations. And 2 weeks ago, when I asked you, Governor, about reopening, which was well underway at that point, I asked you, what should I be asking you 2 weeks from now if those numbers don't go in the right direction? You said at the time, quote, "These are the metrics that have been put forward by the CDC. If they were to go in a different direction, that would be a sign of caution, but they're not." And I understand and respect that the hospital system is not overwhelmed yet, but it seems like you guys are also acknowledging at the same time that there's a concession being made to open as a trade-off for an increases in the state. Why not make changes, or why not make a more forceful message to the public right now as these numbers move not in the right direction?
Vaughn, I really don't know what to add, except that we're going to continue to monitor this. This was our expectation. This is what was foreshadowed by Dr. Christ over the last several weeks. This is why we've worked so hard to provide available hospital capacity, intensive care unit capacity, and ventilators. And we are prepared in Arizona. We are not in a crisis situation. If that were to happen, we have available field hospital capacity, along with the Army Corps of Engineers and the National Guard. So if something were to go in a dramatically elevated position, we'd be prepared in Arizona.
We'll come here. Tell them when you have a question.
What should we tell the public?
The public is watching, and they've seemed to understand this pretty well. And in Arizona, the public has been incredibly responsible, and they're part of the reason that we were able to slow the spread, increased the hospital capacity, and the public's listening and watching.
Thank you. Appreciate it.
I just wanted to follow up on the question about the special session regarding police brutality. I don't think you actually answered if you were going to do that or not. Also, you've been a governor for quite a few years. What have you done significantly to actually tackle this challenge or problem so far?
Well, first I want to say we're going to work with legislative leadership to see what's possible in a legislative session. This is something that, whether it's the body cams, this has been a priority of my administration. Another thing that we have focused on are the second chance centers. The theme of why I ran for office in 2014 was opportunity for all in the state of Arizona. And it wasn't that long ago that the Arizona economy was booming, and anyone that wanted to find a job could have a job and begin to climb the economic ladder and build their career. There is more that needs to be done. There are things that need to be addressed around our law enforcement entities across the country, and I acknowledge that. So does Colonel Silbert. I don't want to speak for other law enforcement leaders, but I don't know that we've ever seen the cooperation that we're seeing among leaders and the women and men who are police officers today to make changes and reforms. Do you want to touch a little bit more on that, Colonel?
Sure. I think reforms began years ago after the Rodney King incident in the early 90s. And since that time, I think police reforms, accountability have grown leaps and bounds. I think sensitivity, I think people having a better understanding of working in diverse and different communities. I think recruitment has been a large part of that. Each agency where I've worked, that's been a priority. And I think each one of those things helps. We continually teach de-escalation. We continually teach different ways to communicate and deal with people in what could otherwise be confrontational situations and sometimes lethal situations. I think advancements in weaponry, in fact, that doesn't get touched on a lot, that are less lethal and can render a situation safe without lethal force, have been implemented. And I think the training has grown, again, leaps and bounds in the last 20 to 25 years.
We'll come over here to CTAR and we'll go thoughts now.
Hello, everybody. Governor, you said you talked to 20 mayors across the state of Arizona regarding setting up the curfew and so forth, and of course deploying the National Guard to those cities. What were your conversations like with Phoenix and Tucson's and Flagstaff's mayors? And we've had Mayor Gallego come on our air saying she hadn't talked to you about stuff like this.
Mayor
Gallego.
Oh, okay. Yeah, I've never talked to as many mayors in the last 2 weeks as I have in these current 2 weeks. So I want to thank the mayors. Our discussions have really been focused on two areas. One has been COVID-19, of course, and Phoenix and Tucson received direct payment from the federal government. So my focus has been with the other mayors and municipalities that were expecting dollars from the state of Arizona. And you may have recalled that we brought all those mayors together to hear how they wanted to have these dollars spent, where the best use of those dollars could be. And then I think we did something last week where we showed that those dollars went out under the same formula that Treasury had provided it to the state, with maximum flexibility and minimum red tape. But like I said, those dollars went directly to Phoenix and Tucson. In terms of the public safety part of the focus, I've got a relationship that predates both of the new mayors. So on Saturday night, there was a lot of concern. I reached out to the chiefs directly on Sunday. Was a focus around policing and public safety as I wanted to make some decisions. I'm grateful to Chief Williams and Chief Magnus for taking the call and providing input.
So you went to the chiefs, you went to the law enforcement leaders first, and not necessarily the mayors in this case.
I've been working with law enforcement leaders. I've also been working with mayors. I don't know all the chiefs like I should around the state, but we did convene conference calls with mayors when I wasn't talking directly with the chief.
And a quick follow-up on the curfew situation. Any chances of you shortening it by a couple of days? Any chance of you extending it by a couple of days? What kind of parameters are you looking at, especially, if you lift a curfew, the looting and the rioting can start all over again?
Well, I want to say thank you to the citizens of Arizona, to the peaceful protesters, to those that want to have their voices heard. It's loud, and we can hear what people want to say. It's also been, I think, 4 consecutive nights of peace and quiet in Arizona. The curfew was put out through next Sunday. So let's just see where we are, and let's keep up the good, responsible, civic-minded behavior. And I think we'll see as the weekend approaches.
This question is for Colonel Silbert. We've all seen you had a conversation with protesters. What did you take away? What did you learn from their message? And with that said, have you spoken to Deon Johnson's family?
Hi, sir. I'll start with the first part of your question. My thoughts were what I stated at the very beginning of this. There's a large group of people, and they wanted to talk. I saw something in some of the young people who were standing in front, and I thought it would be positive. I saw the same things in their eyes that I think everybody was feeling, irrespective of if we're wearing a uniform or or if we were wearing a hoodie. Everybody was upset. Everybody was hurt, and I feel like I got some credit for that, but I really felt like the young man and the young people in the crowd who allowed me to talk and communicate with them should have gotten credit. And so my takeaway from it was those were good people who were exercising their rights and calling for change, which, as I stated, is what our country is founded on. So I came away from it as something very positive. My concern is that there's other people who don't do that, like I said earlier, take advantage of a situation where there's deep hurt and pain going on.
All right, you have just been listening to Governor Ducey address issues regarding the coronavirus, as well as the latest protests that have been happening because of the death of George Floyd. Let's talk about the public health front right now, as far as where Arizona stands. The Arizona Department of Health did acknowledge that, yes, there has been a big increase in the number of cases of coronavirus. However, they said that they attributed that to the reopening of businesses, also the dramatic increase in testing. In fact, coming up this weekend, they'll be entering their 6th weekend of this testing blitz. However, they did say that they expected those numbers to rise. However, the bottom line is there are still plenty of hospital beds, ICU beds, as well as ventilators on hand. Of course, they still stress that keep your groups to no more than 10 if you can, social distancing, wearing masks, everything of that nature. Also, in regards to the latest protests, we know that the National Guard was activated over the weekend. They just gave an update that over the weekend there were 122 National Guardsmen. As of today, there are 1,421 National Guardsmen, and that is because many cities and counties have requested more help. The curfew still is in effect until next Sunday. That's from 8 p.m. until 5 p.m. Of course, this news conference is still happening. You can watch more of it on our website, but now let's get you back over to Ellen.
Bothering people, and rightly so, for a long, long time. The passions were very high in the room. The deliverables in terms of what people wanted around the table that we can act on, in addition to whatever we come to in a legislative session or future legislative session, would be some COVID-19 testing specifically for the African American community and some additional attention to the needs inside that community, a reform, or for lack of a better way to put it, a blue ribbon commission in terms of how we can address AZ Post. How can we make AZ Post more diverse? And how can we allow a young man or woman that would like to participate in law enforcement, but because of some of the rules and regulations that today would disqualify them, how can we fix that? That, along with some ideas around training and diversity on our police forces, were the deliverables that I know are actionable in the state of Arizona. But I want you to know that list alone did not even scratch the surface of the deep hurt and concern inside that room. That's why I said it's not the first meeting. It won't be the last. This has got to be ongoing.
You always say that President Trump is always welcome to Arizona. He's obviously looking for a location for the RNC convention. Is Arizona open for that? Are you worried about not only public health, but also with the protests and what's happening in our country, that things could get out of hand? Is it a possibility?
So the president is always welcome in Arizona. I know I've said that before, and I'll continue to say it. I know there's discussion around the convention. I got to be straight up with you, Billy. I've been focused on the pandemic, the protest, public safety, and wildfires. This is going to be the president's decision and his decision alone. So I want him to choose the place that he thinks is to his best advantage on the electoral map. Arizona's great. at hosting large events. I don't know that there's a place that's better in the entire country. And I also want to say, regardless of the convention or the political party, in the environment we're in right now, wherever the convention goes, there's going to be concerns, and we would deal with them in turn.
Governor, I appreciate how you started this news conference talking about your feelings about the death of George Floyd and the steps you've taken since then. But I was struck Saturday, after a couple of days of unrest downtown in Phoenix and in Tucson. The statement you put out didn't mention George Floyd, and instead it was rah-rah, law enforcement, we're going to protect your First Amendment rights, but we're going to crack down on you. It was tone deaf. It came off to me as a completely tone deaf statement that completely ignored the reason for all of these protests. And I know that since then you've changed some of your statement, you've added to your statements on Sunday but I was just struck by that. And can you tell me why you didn't include any mention of the reasons for this national unrest in your initial statements?
George Floyd was killed on Monday, May 25th. I was in front of this entire press corps on Wednesday, May 27th, with unlimited questions. I was with you the next day on Thursday, May 27th. There were no questions around
There were no
this.
protests at that time.
There were no
Arizona.
questions around this. I've put the statement out that this is an American tragedy and that we can do better as a state and a nation. I stand by the statement.
Nicole, do you have another question? Yeah, just for the Colonel. Protesters, they want transparency. Why are you not releasing the name of the trooper who shot and killed Deon Johnson?
Thank you, ma'am. As you may or may not know, there's two investigations taking place right now. We conduct an internal investigation in an officer-involved shooting or an incident that involves a significant use of force such as that. And at the same time, we conduct, or another agency will conduct, what's called a criminal investigation. Not to infer a criminal act has taken place or has not. It's just we call that the criminal investigation and the internal investigation. In this case, in a large municipal area in the state, such as Phoenix, if our agency gets into an officer-involved shooting, the Phoenix Police Department will almost always take the criminal part of the investigation, and then we'll take the part of the internal investigation. Whereas in other parts of the state, we might end up doing both because of our capacity to be able to do it. But here in Phoenix, Phoenix takes the criminal, we take the internal. Because of that, we really try to respect Phoenix PD's ability and integrity of the investigation, for them to be able to get through the investigation, do the things that they need to do. And I think there would be a conversation when the time is appropriate between both agencies that we feel we can put that information out, that it would be forthcoming. We do have a policy that precludes us from doing that in those situations, but I think as time goes on and more of the facts come out, more of the investigation is revealed, we'll be able to do that.
But this is a call for change for policies like this to wait. They want investigations quicker, video release faster. They want immediate information. So why won't you release the name now? And will you consider changing your policy then?
Yeah, I think there's many things we have to review on a regular basis, from policies to practices. There's a constant review that takes place at our agency, and I think at many forward-thinking law enforcement agencies throughout the country, where they're trying to figure out ways where they can do things better. I've seen in the last decade or 2 decades, although the investigations are very thorough, the departments are trying to get the information out there more quickly and rapidly, but just like any person, all the people involved in an investigation are due process. And because of that, we owe people the best investigation. We owe the community that investigation. I don't want an investigation to go forward and have the community feel like there's things that are left out. I want it to be the most comprehensive, complete investigation so that the community knows that there was transparency, there was veracity, and they understand exactly what happened. So, ma'am, I echo your sentiments in much of that.
We'll go to Brian next, and then we'll do one more. Thank you. A question for Colonel Silbert from one of my colleagues. What is your protocol for clearing a scene, and why wasn't an ambulance allowed into the scene of the shooting in a timely way?
Sir, I can tell you what I know. Some of it I don't, so I apologize if there's parts of it I don't know. I can tell you, I think just recently you heard some of the radio traffic go out. The trooper who was involved in the shooting immediately notified that he was in a shooting, and literally within milliseconds of that was requesting the fire department for medical aid before they started rendering medical aid. I can't answer you as to what took any period of time for fire to roll in. I just don't have that answer, sir, and I wouldn't want to guess.
Okay.
One more question here. We're going to go to Carissa Planell from Ray TV. Carissa, go ahead.
Yeah, my question is also for Colonel Silbert. Last night, Arizona's family aired the traffic camera video that showed the moments after Deon Johnson was shot by the trooper on 101, and to the point of the EMS crews appearing to not immediately have access to Mr. Johnson, even though the scene appeared to be clear. Have you seen the video, and what are your thoughts on what you see in the video?
Ma'am, I've seen the video. I believe the first time I saw it was today. I've seen the video, but I have not seen what Mr. Resnick asked about with the issue with EMT or paramedics coming in or not coming in. So that part of it I can't answer, but I did see the video.
When you asked about systemic racism, you said racism is a sin. Do you believe there's systemic racism here in Arizona?
Racism exists. Racism exists in Arizona, in our country, and in our world. I think it's incumbent on all of us to do everything we can to minimize and eliminate it.
And does that systemic racism exist specifically amongst the police force here in Arizona? And if you do believe it does exist, what are you going to do to stop it and when?
I'm going to say again that racism exists. I'm not going to get into the qualifier. This is something that our nation has been wrestling with since our inception, and something we'll continue to wrestle with. We have improved over the course of time, and this is one of those American moments where it calls for to answer it and for more attention, dialogue, improvement, whether it's reforms, laws, and legislation, but also personal behavior, acceptance, warm-heartedness, open-mindedness. I realize how divided the nation is on so many different issues right now. From what I have observed, the nation is united in justice for George Floyd and the issues that surround that incident. That's what I want to work on.
How many African Americans have you promoted within your office and throughout the state of Arizona?
I'll have to go to HR to get you the numbers on specifics in terms of demographics. I want to say in terms of closing here, it's an incredible time. We're dealing with the pandemic, public health, public safety, of wildfires across our state. You are seeing the best in terms of state and local government, of people coming to the front to protect our citizens, our people inside our state that want to be heard and peacefully protest and call for reform and change inside our state. I want to thank the people of Arizona. We've been able to avoid what has gone on in so many different parts of our country. If you look at the 10 largest metropolitan areas in the nation, whether it's New York, Los Angeles, Chicago, Philadelphia, Dallas, Houston, Boston, Philadelphia, I don't know that anyone has had more civic discourse, less violence, less property destruction. I've always seen Arizona as a model place and a model state, and I believe we can continue to do that as we make the necessary changes to honor the life of George Floyd. Thank you all.
Or not social distancing? I mean, we had the same recommendation come out of the Minnesota Department of Public Health. Maybe that's for Dr. Christ.
I would just say if anybody wants to go get tested, if they feel that they've been exposed and you've been in a group, you can find testing sites at azdhs.gov.
Thank you.